I'm Dr. Manjunath Malige, consultant endocrinologist. On the eve of this World Thyroid Day, I would like to share a bit of information about thyroid abnormalities. Thyroid, as you all know, is one of the most important endocrine glands in the body. It's just situated in front of the neck here, of the shape of a butterfly, and secretes a very important hormone called thyroid hormone. This hormone literally is needed for the proper functioning of almost all the systems of the body, particularly heart and brain. This is also important for the development of the baby and also good pregnancy outcomes in women. Now, there are two things in thyroid one would like to talk about, and these are the two ends of the spectrum. On one end of the spectrum, we have what we call as hypothyroidism, or commonly known as underactive thyroid, which basically means that for some reason, one's thyroid is not producing enough thyroid hormones. So there is thyroid hormone deficiency. On the other end of the spectrum, we have something called as hyperthyroidism, which means one's thyroid will be producing excess thyroid hormones than the body needs. Now, obviously, these two conditions have significant implications on one's health. Now, coming to the more commoner one, which is hypothyroidism or underactive thyroid. As I said, this means that the thyroid is not able to produce enough thyroid hormones. The most common cause of this happening is because of an abnormal protein in the blood called as thyroid antibodies. Once this happens, patients develop quite a few symptoms, the prominent of which are weight gain, hair loss, dry skin, cold sensation, hoarseness of voice, and in women, irregular periods and pregnancy loss. This hormone is very important during pregnancy because it's directly related to the development of the brain and the nervous system of the developing baby. This is one of the commonest conditions in endocrinology and can be very easily diagnosed just by a simple blood test and can be even more easily treated just by a single tablet. So what we essentially do here is replace the thyroid hormone that is missing in the form of a tablet, which is safe and free of any side effects and is used by billions of people across the world. So if someone has any of these symptoms which I just mentioned, it is advisable to have a blood test done for thyroid hormones and see your endocrinologist. Coming to the other end of the spectrum, we have hyperthyroidism or overactive thyroid. So as I mentioned, there is excess of the thyroid hormone production in this situation, and as a result, patient presents with a different set of symptoms, predominantly weight loss, anxiety, palpitations, that's the sensation of heart racing faster, prominent eyes, and shaky arms. Again, it is advisable to get the thyroid function test done immediately and to see your endocrinologist. This condition can be treated by tablets, and if there is an enlarged thyroid gland in front of the neck, one might need operation or surgery to take away the thyroid gland. If surgery is not an option, then we have something called as radioactive iodine treatment, which can be given. So it is essential to diagnose these conditions and treat them appropriately for a better health. Thank you very much.